Okay, I'm going to talk about infection control. So you got standard precautions, which entails gloves, PPEs. This applies to any time that there is blood products or bodily secretions or excretions or non-intact skin. This should be used with every patient. You will perform hand hygiene before, after, and between each patient. You will wash your hands if they're visibly soiled, and after eating, you will use alcohol, waterless antiseptic when your hands are not visibly soiled. And the different types of precautions. First, you've got a droplet precaution. This is used when a patient has got a diagnosis of diphtheria, rubella, mumps, or pneumonia. You will wear a mask or respirator depending on the condition. The patient will be in a private room or in a room with patients that have a similar condition. Then you've got contact precautions. For this, you will wear a gown and gloves. That's for any patient that's got anything such as MRSA, C. diff, wound infection, herpes. The patient will be in a private room or in a room with similar patients, and each patient will have a disposable blood pressure cuff or stethoscope in their room that is specific to that patient. Next is airborne precaution. For that, the nurse will wear a N95 respirator mask. Will have to wear a gown and gloves. It's for any patient that's got measles, varicella, or TB, and this patient will be in a private room with a negative airflow. Next is protective precaution. This is for any patient that is immunocompromised, such as a patient with cancer. For this, the patient will be in a private room with a positive airflow HEPA filter, and they will be on reverse isolation. This is to keep us from infecting the patient. So for this, the patient will wear a mask anytime that they are coming out of the room, and each nurse will wear a mask and gloves and gown while treating the patient. Now they have room assignments for different patients. A patient with TB will have to be in a room by themselves, and a neutropenic patient will have to be in a room by themselves or in a room with a patient that is non-infective, such as a person who is having an anaphylactic reaction. Now, the procedure for removing PPE for putting on PPE is you will perform hand hygiene, put on the gown, put on the eyewear, and put on the gloves, and the procedure for taking them off is backwards of that. You will take off the gown, you'll take off the gloves, then you'll take off the face protection, and then perform hand hygiene.